Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Coreg, or Carvedilol. This is a drug that was FDA approved for the immediate release form in 1995, the controlled release form in 2006. It combines two different activities. It's a beta blocker and an alpha blocker. And why that's important is that it has the potential to improve three different kinds of conditions. It can improve heart failure, congestive heart failure, that also is treated with diuretic and an ACE inhibitor. And sometimes we add the Coreg. It can be used in people who have left ventricular dysfunction after a heart attack. So normally your heart is going to pump more than 50% of the blood in the chambers. But in some people after a heart attack, when the muscle is damaged, they can't even pump out 40%. So this can boost that and improve the condition. So some people after a heart attack, and some people who have essential high blood pressure, essential hypertension, just high blood pressure, can be treated with this drug. Now, heart failure is an important condition. There are more than 5 million people, and that number is increasing, who have heart failure. Heart failure typically brought on by years of high blood pressure that hasn't been adequately controlled. It can be brought on by a heart attack that damages the muscle so the heart can't beat, or coronary artery disease that limits the amount of oxygenated blood that gets to the heart, or valve problems, or sometimes congenital problems. Starts off with some swelling of the feet, then swelling of the legs, then some chest pain and shortness of breath, can't lie flat at night, fatigue, abdominal pain and swelling and bloating. And even under the best of circumstances, say at the Cleveland Clinic, where they give therapy for heart disease second to none, well, looking at the likelihood of readmission of patients who they treat and discharge, about 20% are going to be readmitted within 30 days and 50% going to be readmitted within 6 months. And if we look at the overall survival for heart failure, well, the 5-year survival is about 50%. The 10-year survival is less than 25%. And if you happen to have advanced heart failure, the likelihood of surviving 1 year is about 10%. So overall, heart failure, 1-year survival about 80%, 3-year survival about 60%, 5-year survival about 50%, 10-year survival 15, 20%. You want to know what your likelihood is? Go to heartfailurerisk.org. You can calculate your survival from some simple information that you can provide. This site is maintained by the Heart Foundation, the University of Glasgow, University of Auckland. You need some simple information. You also need your body mass index. That's your weight compared to your height. You need your systolic blood pressure. A simple test of kidney function, and you need to know what your ejection fraction is. Normally should be in excess of 50%. In people who have heart failure, it's less than 35 or 40%. Well, it seems that if we look overall at the statistics, looking at how well Carvedilol functions, it functions okay. It's not a home run, unfortunately, but it's at least as good as it gets at the present time. If we look at the statistics, and we see how patients seem to fare, they oftentimes note that their exercise tolerance isn't any better and their health-related quality of life isn't really necessarily any different, but sometimes they seem to get some benefit, and the investigator and the global assessment by the doctor might show that yes, indeed, the patient seems to be improving. Some of the studies have shown no survival benefit of the drug, but the COMET trial, looking at Carvedilol versus Metoprolol, a similar beta blocker, looking at people who have mild to moderate heart failure, looking at people who had, instead of that more than 50% ejection fraction, these people on average had only about a 26% ejection fraction. The all-cause mortality in the people receiving the Carvedilol, the mortality, all-cause mortality, was 34% at 5 years versus 40% in the people receiving the Metoprolol. And if we look at the cardiovascular death rate among people receiving the Carvedilol, it was 30% versus 35% in the people receiving the Metoprolol. So it does seem that Coreg, or Carvedilol, was better than Metoprolol, except for one thing. They were receiving the maximum dose of Carvedilol, and they were receiving half of the optimal dose of the Metoprolol. So in the Copernicus trial, instead of looking at the mild to moderate heart failure, now the Copernicus looks at the severe heart failure. The average ejection fraction was only 20%. They compared patients on the routine medicine, some of them in addition given the Coreg, others given a placebo. The trial was stopped at 10 months because the mortality rate benefited the Carvedilol group, where the mortality was 13%, versus the placebo group, where it was 20%. So there was about a 35% reduction versus doing nothing. Well, that obviously suggests that at least Carvedilol does something and may be a worthwhile drug. So let's look at people who have a heart attack, and now, because of the damaged muscle, they can't pump out more than 40%. So they have less than a 40% ejection fraction. Some of them had heart failure, some of them didn't. To get into the study, you had to have a systolic blood pressure of more than 90, a heart rate of more than 60. And again, compared to placebo, the all-cause mortality rate during the trial was 12% in the people receiving the Carvedilol and 15% in the people receiving a placebo. And if we look at the relative decrease in the cardiovascular deaths, it was down by about a quarter, down by about 25%, mostly from sudden death and from pump failure. So again, Carvedilol certainly seems to be better than doing nothing. On the other hand, if we look at the total mortality and the all-cause hospitalizations, there wasn't any difference. But there was a 40% reduction in the repeat heart attacks, both fatal and non-fatal. Well, that suggests that, again, Carvedilol is better than nothing. Well, they did a study using the appropriate form of Metoprolol, the metoprolol succinate, and they looked at that compared to the Carvedilol. They did this, and it was called the Danish National Heart Failure Registry, and they looked at 6,000 people about in each group. The target dose was the maximum dose tolerable, and they found that it didn't make any difference whether the people were taking the Carvedilol or the Metoprolol, and the congestive heart failure seemed to be about the same. So it would appear that Carvedilol isn't any special magic compared to, say, Metoprolol or another one called Z-beta. Well, if we look at people who have high blood pressure, now the third indication, beta blockers aren't appropriate for people who have high blood pressure. It's another kind of a drug that can be used, but it's not the first choice. The first choice is a diuretic or an ACE inhibitor, an angiotensin receptor blocker, maybe a calcium blocker. Those are the first choices because not only do they reduce the blood pressure to basically the same amount as the Coreg, but in addition, they reduce the likelihood of dying, of having a stroke or having a heart attack. So beta blockers, not first choice. And as a matter of fact, beta blockers don't seem to work very well in African Americans. They work better in Caucasians. If you take the max dose, say 50 milligrams, it's going to reduce the systolic by about 9 points, the diastolic by about 5.5 points. That's okay, but that's not any better than any of the other kind of medicines that we have available. So how do the medicines work? Why does the medicine work seemingly for heart failure or seemingly when your heart isn't beating right? Well, it decreases the heart rate and it decreases the contractility of the heart, even in the face of an increased amount of autonomic nervous system hormone in the system trying to make the heart beat more forcefully. Well, we don't want it to beat more forcefully because if it beats more forcefully, it's going to use up its oxygen, and it doesn't have enough oxygen getting to it in the first place. The alpha blocker component tends to make the vessels dilate so the heart doesn't have to pump against as high a resistance. Now, normally that would cause a high or an increase in the heart rate, but fortunately the beta blocker component stops that. Well, it seems that in heart failure, we get some benefit from taking the drug because it reduces the blood pressure, reduces the heart pressures inside the heart, reduces the resistance against which the heart has to pump. So all of that is absolutely good. Well, how do we decide on the dose? The dose is either the immediate dose or the slow release or the extended release or the continuous release form. And if a person is going to start off on the immediate release form, it's twice a day versus once a day on the controlled release form. And there are appropriate doses. We begin at a relatively low dose, the lowest in people who have heart failure, intermediate in people who have either blood pressure that's elevated or after a heart attack. And then we increase the medicine over a period of time. We wait about 2 weeks or so in between one dose before we increase it to the next dose. Now, I have to be a little bit careful to make sure the blood pressure doesn't go down too far, to make sure that the heart rate doesn't go down too far, to make sure that the person isn't retaining fluid, all of which is possible. If a person's taking the drug and decides they don't like the drug, they want to get off the drug, can't stop this drug too quickly because especially in people who have coronary artery disease, it seems that if you discontinue the drug abruptly, it might precipitate a severe exacerbation in the chest pain, the angina, lead to arrhythmias, and even a heart attack. So you decrease or slowly decrease the drug over a period of a couple weeks. If you take it with food, it will slow the absorption and decrease the likelihood that you're going to have what we call postural hypotension. When you stand up, the blood pressure falls too quickly. So if you take it with food, that doesn't tend to happen. But if you have severe impairment of either your liver or your kidney function, then probably you can't take the drug because the concentration of the drug in the system would be too high and you would have too many side effects. The side effects of the drug include, the most frequent, shortness of breath and fatigue and a low heart rate, the blood pressure falling too low. Some people feel weak or have diarrhea or weight gain. Any of the beta blockers can lead to erectile dysfunction, and sometimes people develop shortness of breath. Shouldn't take it if you have asthma or if you have any conduction abnormality, significant conduction abnormality in the heart. Maybe you have second or third degree heart block or the sick sinus syndrome or very slow heart rate. Not for people who have decompensated heart failure. And we know that it can lead to fluid retention, so an increase in the dose of a water pill might be necessary. Because it's a beta blocker, it can mask the symptoms of hypoglycemia, which is important if you're a diabetic, especially if you're taking insulin or any other kind of oral hypoglycemic medicine. It can cause spasm of the airway if you have chronic bronchitis or emphysema. Those people should use the lowest possible dose and with caution. It can aggravate symptoms of peripheral vascular disease. It can mask hyperthyroidism or thyrotoxicosis, so you might want to have your blood checked for thyroid hormone activity. Fortunately, it doesn't seem to cause any problem with the kidney, so it doesn't decrease the kidney function like some of the other medicines may. If you drink alcohol, you have to be very careful, especially if you're taking the controlled release form. If you take the controlled release form and drink alcohol, it's going to dissolve the capsule and it's going to make it absorb even more quickly, and then you can have some problems, further problems with headache or dizziness or lightheadedness, or your blood pressure will go too low or change your heart rate too much. If you happen to have angina when you're sitting down, we call it Prinzmetal or variant angina, that's a potential issue. If you're going to have a cataract surgery, you should warn your eye doctor that you're taking this kind of medicine because it can cause some complications intraoperatively. The drug can interfere with the metabolism of other drugs, and other drugs can interfere with its metabolism, so you have to be a little careful if you're taking a selective serotonin reuptake inhibitor, a drug like Celexa or Prozac or Paxil or amiodarone, or if you're taking even fluconazole. Or some of the other heart medicines, maybe like diltiazem or verapamil or clonidine. Got to be very careful if you're taking an MAO inhibitor. So in women who are pregnant, is it appropriate therapy? Well, for the most part, no. It can cause some problems for the unborn infant, and it might even cause some problems with the development of the organs. At least that's what some of the animal studies show. However, if a woman has high blood pressure during pregnancy, it does need to be addressed. Lactation, probably not. Pediatric group, it's not approved. Older people, senior citizens, the plasma level might increase by as much as 50%. So do have to use caution with dosing in seniors. It also is important to realize that the medicine can make you a little bit tired. So if you're driving a car until you see how the medicine affects you, you got to be extra careful. Well, people can overdose on the medicine accidentally. That can lead to a severe decrease in the blood pressure, decrease in the heart rate, cardiac insufficiency or cardiac shock or cardiac arrest even. Or in people who have asthma or a tendency, can lead to bronchospasm. Well, the good news is that the medicine has come down in price significantly, at least the immediate release form. So now you can get the immediate release form, a month worth of therapy. The cash price would only be between $13 and $40. The $13, $14 is the Costco price, the $40 is the Walgreens or the CVS price for cash. You can get a coupon from GoodRx at no cost to you. That gets you the drug for $3 to $27, but if you want the Coreg instead of the generic Carvedilol, cost's going to be $300 or more. On the other hand, if you want the easier to take, the controlled release form that you only have to take once a day, well, the price for 30 of those, if you get the cash price, it's in excess of $250 with a coupon. It's anywhere between about $100 and $200, and about the same up to $300 if you get the trade name. So the bottom line is, heart failure typically is the end result of high blood pressure over a number of years. And you can control that. You can check your blood pressure when you're young. You can check it when you're in your middle age. And if you pay attention to your blood pressure, you avoid cigarette smoking, you follow a healthy lifestyle, healthy diet, you exercise, well, chances are much less that you're going to suffer from heart failure as a 50 or 60 or 70-year-old. And remember, even though we're making progress in treating heart failure, we're nowhere near where we should be or where we want to be. So right now, yes, we can treat you if you happen to have this problem, but unfortunately the outcome of therapy is not nearly as good as it would be if you watch the salt in your food, if you exercise, you control your blood pressure. That's what we want. Primary prevention. Remember that old adage? Ounce of prevention is worth a pound of cure. It fits for heart failure. Thanks for watching. I'm Dr. Ken Landau.